name is Reigina and I'll be doing IV piggyback management. I'm going to do some hand hygiene. I've already compared my physician's order with my mom beforehand to make sure it's been transcribed correctly, and it has been transcribed correctly, and the medication has 2 transcribers. So now I'm going to be introducing you to our patient right now. So Venancio Vines, August 1, 1963. The patient came here because of a scratch by the cat on her left arm. So the patient is experiencing cellulitis, an infection on her arm. So now I'm going to go over the MAR. Venancio Vines, August 1, 1963. No known allergies. Zithromax 400 milligrams IV daily. It's minibag. The date and time is now, and nobody is given to the patient, so we can give it. Do some hand hygiene. I've also noted that there are two transcribers for the medication, so I'm good to go. Do some hand hygiene. Go to my Pixis machine. I'm gonna obtain the vial. So, Venancio Vines, Zithromax 400 milligrams is what we need. We need an IV solution. And sorry, so I'm just gonna do my first med check again. So Venancio Vines, and then we need Zithromax 400 milligrams. We have the 500 milligram vial, IV solution. The time and frequency is daily, and it's currently October 11, 2020, 11:30. Nobody's given to the patient, so we can give it. I've also assessed the integrity of the vial, and it's not expired. And then I'm gonna be comparing it with my PDM, azithromycin, Zithromax. It's antibiotic. The patient is experiencing cellulitis. We have the right order, the right medication, the right reason to give this. It can be administered by a student nurse. The usual dosage is 500 milligrams IV daily. And then we have Zithromax 400 milligrams IV daily, so we did not exceed that. The maximum single dose is 500 milligrams. The maximum daily dose is 500 milligrams. And our dose is 400 milligrams, and it did not exceed that as well. So we are at the 500 milligram IV solution here. And then we need to reconstitute it with 4.8 milliliters of sterile water for injection. The final volume should be 5 milliliters, and final concentration is 100 milligrams per ml. And then this can be given as IV intermittent. We can dilute it in 250 to 500 milliliter normal saline or D5W and administer this over 1 hour. It's compatible with D5W normal saline vector saline solutions, and I've already assessed the primary infusion, and it's normal saline, and it's compatible with the medication according to the PDM. We will let our patient know that they may experience nausea, vomiting, and diarrhea, so we will let our patients know. So what I'm going to do now is do some hand hygiene, and then we need to obtain a sterile water, 4.8 milliliters, to reconstitute it. This is a sterile water. It's not expired. The integrity of the vial is still good. It's not compromised, so I'm going to do some hand hygiene. I'm going to removing the vial cup, I'm going to get an alcohol swab. I'm going to be swabbing the top for 30 seconds, letting it dry for 15. Swabbing the top for 30 seconds, letting it dry for 15. I'm going to do some hand hygiene. And then what I'm going to do is I'm going to obtain our 5 milliliter syringe, bringing it back, sterility. Then I'm going to get our blunt fill needle, bringing it back, sterility. Touching it together. I did not contaminate it. Then we need to get 4.8 milliliters of sterile water. So 4.8, so I'm just going to put this here. I did not contaminate the top. 4.8 of air. And then I'm going to be withdrawing for 4.8. And then I'm going to do the scoop technique to recap. And then I'm going to go over to the sink to remove the bubbles. I can see that there are no more bubbles.
So now I'm going to assess the patient.
So what I'm going to do is, I need to get 4.8. I'm removing the extra normal saline. Extra sterile water. I just want to note, I have sterile water here. Sterile water, so 4.8 milliliters. And then I did not contaminate the top of the vial, so I'm just going to inject the 4.8 milliliter of sterile water. Sterile water is what we need. I'm going to relieve the air pressure. Remove the air pressure. And then I'm going to do the scoop technique. I'm going to be swabbing again the top for 30 seconds, let it dry for 15. Then I'm going to gently rotate the vial in my palm. I can see that there are no more solutions, good. And then I'm going to swabbing it again with a new alcohol swab for 30 seconds, let it dry for 15 because I may have contaminated. I already gently rotated the vial and there are no more sediments, good. So now the new final concentration of the vial is 100 milligrams per ml. And then we need 400 milligrams for the desired dose. 400 milligrams divided by 100 milligrams times 1 ml. We need 4 milliliters. So 4 milliliters. I'm going to be getting our syringe here. I'm going to be injecting 4 milliliters of air. 4 milliliters of air. And then I'm going to be aspirating 4 milliliters. Making sure I did not contaminate the syringe.
Very familiar. So making sure that first my clamp is closed.
Okay, and then I'm going to be doing the scoop technique for recapping the needle. So scoop technique. I did not contaminate the needle, so I'm still good to go. And then I'm removing the bubbles. So removing the bubbles. And then we need to obtain 4 milliliters. I'm going to do this over the med waste container to remove the extra medication. And then I have 4 milliliters here. So this one is the outer one. So I just want to know that there are no bubbles in the syringe. And then it's 4 milliliters here. 4 milliliters. And then what I'm going to do now is I've already prepared my label. Here's my label. And then what I'm going to do is I'm going to be comparing, doing my second med check. Azithromycin, Zithromax, 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 Zithromax. I'm sorry, it's for Venancio Vines, Zithromax, 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 400 milligrams, 400 milligrams. Then we obtain 4 milliliters to get the desired dose, IV solution, daily. The time is now, and nobody is given to the patient so we can give it. Good. So this goes to the med waste container, do some hand hygiene, and also according to the PDM, we can dilute this in 250 milliliters to 500 milliliters no more saline. I chose 250 milliliters because the patient has heart failure and they have fluid restriction. It's not expired, it's in good condition, so I'm gonna get my new alcohol swab, and then I'm gonna be swabbing the injection port for 30 seconds, letting it dry for 15.
There are no occlusions and it is running properly.
Making sure I inject in a straight manner so I won't perforate the IV bag.
No swelling.
And then I'm gonna do the scoop technique. Scoop technique. I'm gently rotated my mini bag. Then there are no more sediments. It's all clear, good. And then I'm gonna attach my label that I've made. I also want to take note that I've injected 4 milliliters, and then this is 250 plus 4, 254 milliliters. Good. So now what I'm going to do is I'm going to bring this, do some hand hygiene, alcohol swab, do some hand hygiene and get this. And then I'm going to get this. This goes to the Sharps med waste container. And then I've also made my tubing label beforehand with today's date and the time and my initials. So now what I'm going to do is I'm doing my hand hygiene. As I'm entering the patient's bedside, I'm also making sure that the bed is in the lowest position, making sure the colb is within reach, the patient is not in distress, and there are no environmental hazards. Hi, my name is Reigina. I'm still a nurse from UAL. Can I see your armband, please? So, Venancio Vines, August 1, 1963, August 1, 1963. Non-allergies. Can you state your name and your date of birth? It matches your allergies. It matches. Good. So, what I'm going to do here is do my third check real quick. So Venancio Vines, Zithromax, 400 milligrams, IV mini bag, daily. The time is now. Nobody's giving to the patient, so we can give it. Good. Doing some hand hygiene. Okay, I'm just gonna assess your IV site. Any pain? No pain. There's no swelling. There's no redness. It's not cold or hot to touch. And I've seen that it's all connected well. There are no kinks. I've also assessed that this is not expired and its normal saline is compatible with our medications as per the PDM. It's not expired and it's running at the appropriate rate. Good. So I'm gonna do some hand hygiene. Okay, Venancio, your doctor prescribed you Zithromax because you have cellulitis, the infection of the skin. So we have an antibiotic for you. I've already assessed your vital signs beforehand, and they're within the normal range, which allows me to see if they give the medication to you. You may experience diarrhea, nausea, and vomiting. So call me whenever you are experiencing that during the treatment. I will assess for your vital signs and appropriate interventions after and during the treatment as well. Would you like to take this medication? The patient says yes, he will take it. Good. Do some hand hygiene here. And then what I'm going to do is I'm going to be attaching this so we can back time. So what I'm going to do now is I'm going to be getting our tubing. I'm also going to be making sure that I'm closing the clamp so we're not wasting any of the medication. What I'm going to do is I'm going to aseptically attach them together.
Can we get something yummy for lunch? Like, we deserve it.
Okay, so what I'm going to do now is I'm going to put it above it. And then I'm going to get my alcohol swab. I'm going to be swabbing the injection port above the top. If the cap is still on, it's not contaminated. So I've chose this. So I'm going to be swabbing for 30 seconds, letting it dry for 15. So swabbing this for 30 seconds, letting it dry for 15. Swabbing it for 30 seconds, letting it dry for 15. I'm going to be aseptically attaching them together. And then what I'm going to do is back cut, lowering this, opening my clamp, watching for the bubbles to be no more in the tubing. There are no more bubbles in the tubing. Good. I'm going to hang it back up again. Make sure that your chamber is 1/2 to 1/3 full, and it is. I'm gonna go to my secondary. The rate is 254 milliliters per hour, which is that one, 254 milliliters per hour, 254. The volume is 254 as well. 254, 254, 254, and the callback is yes, because we're going to be flushing for 15 cc to ensure that we're giving the entire medication once the machine is calling us for callback. And also we're going to ensure that the primary infusion has been restarted when we're doing our callback, so we can give the patient the appropriate dose and the primary infusion will be restarted. So before I press start, opening my clamps, all the clamps are open. I'll press start. I'll confirm secondary and then start. I have assessed 254, 254. It matches my calculations and it's starting. I'm observing the drip chamber for 1, 2, 3. For demo purposes, I'm gonna say that I've seen 3, or actually there are 3. There are 3 in the drip chamber of the IV mini bag. Good. Is there any pain? No pain. It's not swelling. There are no redness. Good. All of the lines are connected correctly. I'm also just gonna sign 3 that I've given your medication. So the date is today, the time is now, and my initials. And then I'm also gonna chart in the ins and out that I have given the medication, the call box within which the patient is not in distress, the patient's bed is in the lowest position, and the call box within which, and then I've ensured all of the lines are connected correctly. I've done my exit safety check. I'm done.